She thought their dog was developing a problem. He was trying to solve one they didn't know they had. It started on a Thursday, and it did not make sense on Thursday, and it did not make sense on Friday. And by Saturday morning, when Adrian Voss walked into the living room and saw it happening again, he stopped in the doorway and stood very still for a long time before he said anything at all. Bailey was a 5-year-old golden retriever, a broad-chested, amber-furred, fundamentally cheerful animal who had coexisted with their 2-year-old son, Owen, with the practiced ease of a dog who had simply decided that children were things you moved around carefully, not things you worried about. He had never shown possessiveness. He had never showed guarding behavior. He had never once in the 26 months since Owen arrived done anything that required discussion. Until Thursday. Owen woke Thursday morning with a low-level fussiness that his mother Renata recognized as pre-illness behavior. Slightly subdued. Slightly warm. Not alarming. Just the way a toddler felt on the first day of something that would probably pass. She gave him his breakfast, watched him eat half of it, and set him on the playroom floor with his train set. Bailey lay down beside Owen, not at his feet, not across the room, but directly beside him, shoulder against shoulder facing the same direction. Owen continued playing. Bailey did not move. When Owen shuffled left to reach a piece of track, Bailey shifted left. When Owen stood and walked toward the bookshelf, Bailey stood and walked with him, one step behind. Close enough that Owen's small hand could reach the dog's back without stretching. Renata watched for a few minutes. Then she said, "Bailey, come." He looked at her. He did not come. She said it again. He got up, took 3 steps toward her, stopped, turned back and lay down beside Owen again. She thought, that is new. She filed it as one of those dog things with no clear explanation and went to make lunch. The behavior continued all day. Every room Owen went to, Bailey followed. Not the normal follow, the casual background presence of a dog moving through a house alongside its family. This was different, position-specific, intentional. When Renata put Owen down for his nap, Bailey lay outside the nursery door without being asked, and was still there when Owen woke up 40 minutes later. Adrian got home at 6. He watched it for maybe 10 minutes before he said, "Is he okay?" She said, "He hasn't left Owen's side all day." They stood together in the kitchen doorway, watching Bailey sitting beside Owen's high chair during dinner, pressed close, not begging for food, not even looking at the food, just present, oriented entirely toward the boy. Adrian said, "That's a little strange." By Friday afternoon, Renata had a theory. Owen had been to a new playground the week before. Bailey might have picked up that Owen smelled different, maybe from another child's dog, and had entered some kind of protective mode. She had read about scent-triggered guarding behavior in dogs. It made sense. She tried separating them, putting Bailey in the back room with a chew toy, and closing the door. He was quiet for 11 minutes. Then he scratched at the door in a slow, patient rhythm that did not stop until she opened it. If you stay for stories about what animals sense before we do, you're in the right place. Subscribe so you don't miss the next one. Saturday morning was when Adrian froze in the doorway. Owen was seated on the rug in his coral red long-sleeve shirt, playing with building blocks, happily occupied, not crying, not distressed, perfectly fine by every visible measure. Bailey was beside him with his broad golden head turned toward Owen's chest, not his face, his chest. The dog's nose was pressed gently against the fabric over Owen's sternum, drawing slow, careful breaths. Adrian watched for 30 seconds. He had grown up with dogs. He had lived with dogs his entire adult life. He had never seen a dog do that, press its nose to a person's chest. Hold position. Just breathe. He took out his phone and filmed it. 6 minutes of footage. Bailey's nose against Owen's chest. Steady, patient, completely focused. He sent it to the veterinarian that afternoon with a message that said, "Is this anything?" Dr. Sasha Orimoto called back within the hour. She said she'd forwarded the footage to a colleague. She said she wanted them to bring Owen to see his pediatrician on Monday. Not urgently, but promptly. And she wanted them to mention one thing specifically: irregular heartbeat. Has your dog ever done something that made no sense until it was the only thing that made sense? Tell us in the comments. These stories deserve to be heard. The pediatrician listened to Owen's heart for 60 seconds. Then she listened again. Then she called for an EKG. Owen had a cardiac arrhythmia, an intermittent one. The kind that produced no external symptoms in a healthy-seeming toddler, going about his ordinary days. The kind that did not register on a standard well-child visit. The kind that could produce sudden complications without warning under the right conditions. The kind that a dog with 300 million scent receptors and a direct channel to the chemical output of a stressed autonomic nervous system had apparently been detecting in the boy's exhaled breath and skin conductance since Thursday morning. The pediatric cardiologist who reviewed the case, Dr. Emmanuel Osei at Children's Cardiac Center, later told them that this pattern of presentation, a dog repeatedly orienting to a child's chest and face, was documented in the veterinary behavioral literature. Cardiac patients produce a specific volatile compound signature. Dogs detected before any symptom is clinically visible. He said, "Your dog was doing what your monitors hadn't caught yet." Every guardian deserves to be recognized, even the ones who never asked for anything in return. If stories like this matter to you, subscribe so you never miss the next one. Owen's condition is being managed. He has a pediatric cardiologist who sees him every 6 weeks. He has a monitor and a protocol, and a mother who calls the cardiologist's cell phone if anything feels off. He also has a golden retriever who still sleeps beside his bed every night. Not because anyone told Bailey to. Because Thursday morning, something changed in the way the boy smelled. And he decided without explanation or permission or recognition that the post beside that child was his. And that nothing had changed to suggest he should give it up. Adrian kept the 6 minutes of footage. He watches it sometimes, not for the dog, but for the image of his son sitting there in his red shirt, building blocks, completely unaware of anything, while the golden head pressed gently to his chest. Read the thing inside him that no one else in that house yet knew was there. The next story involves a dog who walked away from a family for a reason no one understood until the test results came back. Stay with us.